Yes, students, now we are going to discuss cranial nerves second and eighth, ninth, 10th, 11th, and 12th. Second, the name of the second cranial nerve is optic. This purely sensory, attached to the forebrain, and this because optic nerve is formed in the eyeball, in the retina, because the receptors of vision are located in the retina, roots and bones. So this optic nerve from the orbital cavity enters into the cranial cavity by passing through optic canal. Its cranial nerve, its name is vestibulocochlear nerve. Its function is hearing and balance. It is also a pure sensory nerve, and it is attached to the bones. And vestibulocochlear nerve is formed in the internal ear, and that is buried in the petrous part of temporal bone. From the petrous temporal bone, this vestibulocochlear nerve enters in the cranial cavity by passing through the internal acoustic meatus. Ninth cranial nerve name is glossopharyngeal nerve, and glossopharyngeal nerve exits the cranial cavity through the jugular foramen, and it is attached to medulla oblongata. And glossopharyngeal nerve is mixed motor and sensory, as well as it contains the parasympathetic fibers. 10th cranial nerve name is vagus nerve. It is a mixed nerve, motor sensory, and also it contains parasympathetic fibers. And it is attached to medulla oblongata and passes through the jugular foramen. Name of 11th cranial nerve is accessory. It is purely motor. No sensory fibers and no parasympathetic fiber. There's only motor nerve attached to the medulla oblongata and exits the cranium by passing through the jugular foramen. Well, cranial nerve name is hypoglossal nerve. It is also motor for muscles of tongue. It is attached to medulla oblongata and it also passes through the hypoglossal canal as we all know. This is picture showing the attachment of cranial nerves in the brain. This is the first, this is olfactory, this is second nerve. Only these two nerves, first and second, are not attached to the brain stem. Otherwise, all the other cranial nerves from third to 12th, these cranial nerves are attached, they emerge from the brain stem. But we are not concerned now with the third, fourth, fifth, and sixth, and seventh. We are concerned with the eighth. Eighth cranial nerve is attached here at the junction of pons and medulla oblongata. 9th, 10th, and 11th are attached to the medulla oblongata behind the olive, and 12th cranial nerve between the olive and pyramid. This is the same picture showing the attachment of these cranial nerves to the brain stem. These are the foramen showing, but we are not concerned with this cribriform plate of ethmoid bone for the filaments of olfactory nerve, but we are concerned with optic canal. For the optic nerve, second cranial nerve, we are not concerned with superior orbital fissure and foramen rotundum and foramen ovale internal acoustic meatus. Here is petrous temporal bone. This is internal acoustic meatus for the eighth cranial nerve, and here is hypoglossal canal for the 12th cranial nerve, and here is jugular foramen for 9th, 10th, and 11th cranial nerves. This we can see. This is optic canal, this optic nerve in the optic canal, and here we can see hypoglossal nerve in the hypoglossal canal, and here is 9, 10, and 11 cranial nerves, and this is jugular foramen. And here is internal acoustic meatus, and here we can see the eighth cranial nerve, that is vestibulocochlear. So before starting these from second and eighth to 12th nerves, there are some general points about the cranial nerves. We know that the first, second, and eighth are purely sensory nerves, and 5, 7, 9, and 10 are the mixed nerves. Third, fourth, sixth, 11, and 12 are motor. And only four nerves, third, 7, 9, and 10, they carry parasympathetic fibers. Distribution or function of these nerves. Second cranial nerve, the function or distribution is vision, and eighth is for hearing and balance. Ninth cranial nerve is sensory for posterior one third of tongue. General sensation, pain and temperature, as well as taste sensation. And it is motor only for one muscle, that is stylopharyngeus muscle of the pharynx, and it is parasympathetic to the parotid gland. Tenth cranial nerve, that is vagus, is sensory to from heart, lungs, and GIT. It is parasympathetic to heart, lung, and GIT. It is motor to muscles of palate, except one. Muscles of larynx, muscles of pharynx, except one, sternopharyngeus. And 11th cranial nerve is motor for only two muscles, trapezius and sternocleidomastoid. And hypoglossal nerve is motor for muscles of the tongue, except one. This is the optic nerve. Optic nerve is found in the retina, and this is the optic nerve. It leaves the orbital cavity and enters in the cranial cavity by passing through the optic canal. Here the right and left optic nerves, and then optic nerve travels backwards and medially. And here at the optic chiasm, that is both superior and anterior to the pituitary gland, to the sila turcica. The optic nerve decussate, but only the fibers coming from the nasal half or medial half retina, they cross to the opposite side. Fibers coming from the temporal half or lateral half retina, they do not cross. And this crossing as X-shaped structure is called the optic chiasma, and then it forms the optic tract. Optic tract contains half fibers from the opposite retina and half fibers from the same side of retina. So this is optic nerve, and this is optic chiasma, and here is optic tract. And this optic tract then going to the diencephalon and to the visual cortex, that is in the occipital lobe, in and around the calcarine sulcus. So here again, in this picture, it is very clear. This is the retina, and these optic nerve, these fibers coming from the nasal half of retina, they are crossing to the opposite side. Coming from the temporal half of retina, they are not crossing, and form the optic chiasma. And here they, after optic chiasma, they form the optic tract, and then they synapse here in the lateral geniculate body, and then visual radiations, and they going through the sublentiform, sublentiform of the internal capsule, and then coronarita into the visual cortex. Here is vestibulocochlear nerve. Vestibulocochlear nerve is two parts, vestibular nerve and cochlear nerve. This is formed in the internal ear. Receptors for the hearing part of the cochlear nerve is organ of condyle, and receptors for the vestibular nerve is cristae, cristae ampularis and maculae. This is in the vestibule and saccule and the semicircular canals. Here, yes, these nerves. These central processes of this, then the synapse in the ear. This is the cochlear nerve, spiral ganglia, and here is vestibular ganglia. Thus, these nerves from the vestibulocochlear nerve, they enter, leave the petrous temporal bone, enter in the cranial cavity by passing through the internal acoustic meatus, and they enter in the brainstem with these synapses with the cochlear nuclei and vestibular nuclei. This is the vestibulocochlear nerve. Glossopharyngeal nerve, it is motor, sensory, and parasympathetic. Glossopharyngeal nerve enters in the pharynx and tongue. But important fibers of glossopharyngeal nerve is through the parotid gland. Here is parotid gland. The glossopharyngeal nerve nuclei are the inferior salivatory nucleus of the glossopharyngeal nerve, that is for the parasympathetic, and they supply the parotid gland. We are not going in much detail of this. This is the vagus nerve, 10th cranial nerve. It is a mixed nerve, sensory, motor, as well as parasympathetic. Its innervation is not limited to the head, but also it is the only cranial nerve that extends in the neck, thorax, and abdomen. It is the longest and most widely distributed cranial nerve. It spreads the fibers of the cranial part of accessory nerve, that is 11th cranial nerve, and carries majority of the efferent fibers of the cranial part of the parasympathetic outflow. Vagus nerve associated with the derivatives of the fourth pharyngeal arch. It is sensory to the skin of the external acoustic meatus and the internal surface of the laryngopharynx and larynx, and provide visceral sensations to the heart and abdominal viscera. It is especially sensitive to taste sensations from the epiglottis and root of the tongue. It is motor for the most of the muscles of the pharynx, soft palate, and larynx. And it is parasympathetic to the smooth muscles of the trachea, bronchi, and GIT, and regulates the heart rhythm. In the head, the branches within the cranium are auricular branch and meningeal branch. Auricular branch supplies the posterior part of external acoustic meatus, and meningeal branch appears from the superior ganglia, enter the cranial cavity by the jugular foramen, and supply the dura of the posterior cranial fossa. In the neck, it passes into carotid sheath. You know the contents of the carotid sheath are internal carotid artery or common carotid artery, and internal jugular vein, and behind these two, vagus. So it passes into the carotid sheath. At the base of the neck, the right and left nerves have different pathways. As we know from the pharyngeal arches and its derivatives alphabet, the right vagus nerve passes anterior to the subclavian artery and posterior to the sternoclavicular joint. They enter the thorax. The left vagus nerve passes inferiorly between the left common carotid and left subclavian artery. Posterior to the sternoclavicular joint, they enter the thorax. Branches in the neck are pharyngeal branches, superior laryngeal, and right recurrent laryngeal nerve. Pharyngeal branches to supply most of the muscles of the pharynx and soft palate. Superior laryngeal nerve splits into internal and external laryngeal nerve. Internal laryngeal nerve supplies the mucous membrane of the larynx, and external laryngeal nerve will supply the muscle of the larynx. Right recurrent, only one muscle of the larynx. Right recurrent laryngeal nerve hooks underneath the right subclavian artery that ascends toward the larynx, supplies most of the intrinsic muscle of the larynx. You can say except one. In the thorax, right vagus nerve lies between the trachea and azygous vein, behind the root of the lung, posterior to the esophagus, and enters in the abdominal cavity by passing through the esophageal opening of diaphragm at the level of 10th thoracic vertebra, and then passes posterior surface of the stomach and form the posterior vagal trunk, and branches to celiac and superior mesenteric plexus. Left vagus nerve descends between left common carotid artery and left subclavian artery. It crosses left side of aortic arch, behind root of the left lung, anterior to esophagus, and then enters through the esophageal opening of diaphragm in the abdomen. And that it passes through the anterior surface of stomach and form the anterior vagal trunk. In the thorax, the right vagus nerve form the posterior vagal trunk and left form the anterior vagal trunk. The vagal trunk enter the abdomen via esophageal aorta. Branches for the vagal trunks contribute to the formation of esophageal plexus that innervates the smooth muscles of the esophagus. The other branches in the thorax are left recurrent laryngeal nerve and carotid branches. In the abdomen, the vagal trunks terminate by dividing into branches that supply the esophagus, the stomach, and small and large intestine up to the left colic phalange. What are the effects of cranial nerve lesion? This is the effect of the second cranial nerve lesion. If one optic nerve is lesion, it results in ipsilateral deafness. If the middle fibers of the optic chiasma that may occur in pituitary adenoma, these are interrupted that it results in bitemporal hemianopia. If optic tract is lesion, it results in contralateral homonymous hemianopia. Vestibulocochlear nerve injury, lesions of the cochlear nerve results in hearing impairment, and lesion of the vestibular nerve division results in vertigo, nausea, ataxia, and nystagmus. Glossopharyngeal nerve injury results in sensory loss in the pharynx, loss of taste and common sensation from the posterior one-third of tongue, and there's some pharyngeal weakness and loss of salivation from the parotid gland. Vagus nerve injury results in nasal regurgitation of fluids, nasal tone of voice, and hoarseness of voice. Bilateral recurrent nerve injury results in dyspnea and dysphonia. Accessory nerve injury results in turning the chin toward the side of the injury, limitation in overhead abduction of arm, and inability to shrug the shoulder. This is the picture of accessory nerve injury. Hypoglossal nerve injury results in deviation of the protrusive tongue to the affected side. The tongue will protrude. You ask the patient to protrude the tongue, and the tongue will be deviated towards the side of the leaf. This is the end of our lecture. Now, thank you, and you enjoy yourself. Stop.